Start. Okay. Okay. I see you. So there's 5 participants. 7. Oh, there's Marilyn. Marilyn finally got the link, huh? Screen. Wait a few more minutes.
Can you hear me? Hello?
Can you hear Carmen? I could
I
hear
can't
her.
hear you. Wait a minute, I may be on mute.
Good afternoon, Marilyn.
Hi.
Hi, I can't. Can you hear
How's
me?
everybody doing?
Okay.
Good.
Let me put myself on mute.
Can you hear me?
I can hear you. Can
Okay,
everybody
wait.
hear us?
Okay, I can hear you. Can you hear me?
Yeah, I can hear you.
Okay. Juana, you want to test?
You guys could hear me.
Gotcha. You're loud too. I am too. I got it. Maybe because we are close by. So thanks for joining. We're going to get started in a few more minutes. Linda Shiro. I think people had a hard time logging on. This is the webinar for people who are technically savvy.
You got an echo.
Yeah, Tuan is in my office nearby, and I think the computers are talking to each other more so than to us. Okay, it's 5 o'clock. We're going to get started. Thanks for joining us, everyone that could join. This is the 2022 Annual Enrollment Plan Virtual Update of Lifetime Financial Group. Today's agenda will consist of 3 presenters, myself, Marilyn Parches, who's a Medicare specialist and consultant of Lifetime Financial, and Tawana Steele. She's our customer service manager of Lifetime Financial. And on the side is our building. If you're down State Street, you can recognize our offices by the old bank building. That's where we're located. And it's only 1 story for anyone who was interested in visiting. The agenda today is we're going to cover the state of the Medicare market, what's new in 2022. You're going to find more vision, dental, and over-the-counter benefits, as well as the Medicare Part B reimbursement. Plan reviews will be for Aetna, Excelis, United Healthcare, MVP, WellCare, and some prescription drug programs. Mr. Gorsica, you have your hand up. You can speak. I'm trying to figure out how to unmute you. Can you unmute yourself to speak? Gorsica? Well, we'll have to figure that out. Marilyn and Tawana, if you can figure out how to unmute the participants. This is my first time, so please be patient with me. We're going to talk about special programs like the Medicare Savings Program that saves $148 a month in your Part B premiums, the Hospital Patient Assistance Program, and the State Pharmaceutical Program, EPIC. And lastly, we'll go over scam alerts. There's many different types of scam alerts out today, and we just want to review a few. So let's talk about the state of the Medicare market. MAPR, the 21st Century Cures Act, and the 2021 Advance Notice Act. If you noticed in January the 1st of 2020, everyone received new beneficiary identifiers, which fully replaced your old cards with a different number that had numbers and letters mixed together. Due to the MAPR law, Plan F, effective 2020 of January the 1st, was discontinued, and Plan G replaced it with guaranteed issue for individuals who are new to Medicare. The 21st Century Cures Act removed the Medicare Advantage disenrollment period. That used to be from January 1st through February the 14th, and now it's replaced with the open enrollment period that starts on New Year's Day and ends at the end of March 31st of 2021. Effective January 1st of 2021, people with end-stage renal disease or dialysis were eligible to enroll in Medicare Advantage programs. And you may notice that this year your maximum out of pocket increased. If it's an Advantage program, it went from $6,700 to $7,550, which was primarily due to the end-stage renal disease participants who have dialysis, which is a very expensive procedure. And then some maximum out of pockets went from $3,400 to $3,450. So let's talk about the state of the Medicare market. You're going to find that large retailers are entering the Medicare space, like Walgreens. In fact, if you go to their website, they're already offering Medicare plans, and Walmart will soon enter the space. 2 years ago, CVS purchased Aetna. And so CVS owns the medical records of Aetna, and in some CVS stores in large markets, and even in Rochester, you can go in the store and see a doctor for urgent care needs. And so that's new for the Medicare market. When you talk about CMS, the Center for Medicare and Medicaid Services, care for the patients are becoming more and more important. And so CVS is focused on 4-star plans and above. They want the plans to be 4 stars and above. So each plan has a star rating, and the star ratings go from 1 to 5, with 5 being the best and 1 being the worst. And below 3, CMS usually cancels the plan. In 2023, this is going to quadruple for star ratings of Plan 4, because CMS is really looking to increase the care for patients who are Medicare beneficiaries. And so prescription drug plans will have access to a 6th tier. Right now you have 5 tiers for PDP plans. What's new is that there's going to be a preferred specialty drug plan tier, which is 6. I'm seeing a lot of the carriers are putting vaccines as a tier 6, like Excellus offers the shingles shot, and then there's other different vaccines like what do you call those? The pneumonia vaccine, and you have the flu vaccines. Some of those may be moving to tier 6 in some plans, and then there'll be other drugs. Also, CMS is cracking down on pharmacies, pharmacy benefit managers, and they're requiring a real-time beneficiary tool so that beneficiaries have a way of determining the cost of their drugs, and they're able to find lower cost alternatives. CMS is also requiring plans to disclose quality measures they use to evaluate pharmacy performance in their network agreements. And so you're going to see that the pharmacies are going to have tighter procedures and they're going to be more customer focused for your needs. Also, you might notice that in the prescription drug market in this country, there's only 6 carriers that own 92% of all the business. And so at the top of the chain is CVS and Express Scripts. And then United Healthcare owns their own pharmacy, and Humana owns their own prescription drug pharmacy. And then there's 2 other smaller players that are in the market. And what CMS is trying to do is to regulate what they're doing so that there's more competition. When we talk about Medicare supplement market, we're going to start seeing higher discounts coming in and higher, a better underwriting. And then what the plan is to lower the cost of Plan F. So when Plan G was introduced, Plan G was introduced at a much lower rate than Plan F. And so people who are on Plan F are paying a higher rate. And the only difference between Plan F and Plan G is Plan F pays your Medicare Part B deductible and Plan G doesn't. That's the only difference. Otherwise, they're the same exact plan, but the price may be $100 different between the 2 plans. And so CMS is trying to make it a little more level so that people who are older in Medicare is not saddled with the higher costs than people who are new to Medicare. So let's talk about some of the legislation proposed. The Improving Medicare Coverage Act of 2021, introduced in the House of Representatives in September, would, if it's enacted, lower the age of eligibility for Medicare to 60. According to the co-sponsors of the bill, this would expand coverage to some 23 million people, which is nearly 25% of whom have no health coverage. The Biden administration's current proposal is to include things that Medicare doesn't cover, like dental, vision, and hearing, as Medicare Part B. Today, if you have a Medicare Advantage program, you're getting these things in Medicare Advantage. But keep in mind that 30% of the population have Medicare Advantage, another 30% have Medicare supplement plans, and another 30% of the population have no plan at all. They just have straight Medicare or straight Medicaid. And so the argument in Congress is, well, people can get a Medicare Advantage plan, but that's not something that Congress wants to force upon people. So what they want to do is make the things that we need as we age, like dental and vision and hearing aids, be included in Medicare Part B so that all Americans have access to the benefits. Older Americans are going to see their health coverage expanded as part of this $3.5 trillion budget package that is a challenge right now in Congress, and there's no guarantee it will be approved. But if approved, benefits for Medicare beneficiaries will get better. Okay, so let's talk about the 2022 plan changes. And we have a Q&A here. Question. I can't hear you, Bob. Okay. So Bob, I can't hear you. And I'm trying to find the unmute button so that I can hear you. Can you speak now? Bob? Okay. That's a technical difficulty. I apologize. But I want to go through the 2022 plan changes. And we have lots of changes this year. And as we mentioned, they're getting better and better for beneficiaries. Okay, so let's start out with Aetna. So new for Aetna in 2022 are a couple of great things. Aetna has a new plan called the Medicare Discover Value Plan, which is a PPO, but it's suitable for people who have extra help or low income subsidy and they receive discounts on their drugs. You're going to see zero copays for labs for people with diabetes, for A1C tests and urine protein tests and COVID testing. There's a zero copay for diabetic eye exams and $100 day supply. Excuse me, that's not $100. $100-day supply of eligible prescription drugs, maintenance drugs particularly. So that's a typo. It's actually a 100-day supply, not $100 a day. You're going to see enhanced dental benefits in all of the Aetna plans. You're going to see 4 different dental packages that are available in 2022 as opposed to the one that you have in 2021. There's a new over-the-counter kit. If you're an Aetna beneficiary who received their plan today, you received a one-time delivery of a box of over-the-counter items during COVID. Aetna has gotten that approved through CMS, and they're going to continue to deliver items to beneficiaries as needed, especially during the pandemic. So that's a benefit. There's new reduced cost share on freestanding surgery centers. And so if you had outpatient surgery through a surgical center or through a hospital, next year in 2022, your copay will be reduced. And then there's a new enhanced prescription drug benefit of zero copay for tier 1 and tier 2 drugs at the preferred retailer, which is CVS or Wegmans, or you can go through the mail order and receive tier 1, tier 2 drugs, which are generic drugs in nature, for zero copay. Aetna is going to continue the great benefits they've always offered, like silver sneakers, telehealth, resources for health, meals. If you're in the hospital, they have the Medicare buyback program of 2021 that will continue in 2022. With the Aetna credit program, you'll receive a $35 payment each month for your Aetna, for your Part B premium. And then Aetna has a dual special needs plan at zero copay with zero cost sharing, and they will continue to offer vision and hearing aid benefits. And there is an Aetna Eagle veteran program and plan. And so one thing we're excited to, if you don't have any questions regarding Aetna, I'd like to go to Excelis, which we're really excited to report that Excelis has obtained a 5-star rating, which is the best rating of customer service. A 5-star rating is recognized by CMS as a rating that promotes a plan who has a measure of benchmarks such as Medicare beneficiary chronic conditions like diabetes and health and high blood pressure. Medicare members are receiving their preventative screenings, and the plan is teaching members how to correctly take their medications, and they have overall service. Because Excelis is a 5-star rating, you can join in a special enrollment period anytime this year. As long as you're a 5-star, if you decide you're in a different plan and you want to go to a better plan, the 5-star is a SEP, and it will allow you to join the Excelis plan. And so let's talk about the Excelis benefits they have this year in terms of their changes. There's a new lower premium for many of their plans. They have a reduced premium for their primary and specialists for most of their plans. All the Aetna plans offer preventative dental, and some at a small fee. So if you're in the zero premium plan and you have Excelis, you can go to the dentist and get your teeth cleaned for $15, get an exam for $15, and receive x-rays for $15 twice a year. All plans will include an eyewear allowance of a minimum of $100, but some plans have more than $100 in offering. Aetna participates in the Part D Senior Savers Model, which is the insulin savings program, in all the plans except for the zero premium plan. There's a new meal delivery service. If you are in the hospital or inpatient, then you can receive meals delivered to your home. And then Aetna has a new plan called the Blue Choice Value HMO plan, which offers many benefits to seniors. And it's also a Patriot, one of the Patriots plan beneficiaries could use. There's a known rate for out-of-patient hospital and surgical centers. Last year in 2021, well, last year, plan year, which is this year, 2021, you had to pay a 20% co-insurance if you were in the zero premium plan. Next year, you're going to have a dollar amount and to pay, which is a known rate, and it's lower than many of the plans were this year. And so every plan is going to have a surgical center rate, and it's going to be at a very competitive price. Okay, so Marilyn's going to start here with United Healthcare and review the United Healthcare benefits and changes for 2022.
Do you have my sheet to put up there?
I do, but it's an eye chart. If you have the original chart, then it'll be easier. So the next screen is your eye chart. Your
This
sales.
is my chart right here. Well,
Yes.
United Healthcare has made the application a little easier. You have less page to fill out. Also, with the HMO that they offer, it's zero premium. That doesn't change. The changes for the HMO were in the tier, the 250 deductible got reduced, and it has a full tier 1 full gap coverage. And that's about the changes that are in the HMO. I do want to mention that United Healthcare is one of the most financially stable companies. They're number 5 in the world as far as health insurance companies. Also, they increased their star rating from 3.5 on the HMO to 4. So they're doing a good job with the star and with customer service. As far as the PPOs for 2022, the $16 a month one, they have a 4.5 star rating. And I got to look at the changes just a minute. Their PCP specialist is 0. That's a good change. And they have eyewear of $100 per year. And the $100 applies to the frames. It doesn't apply to the lenses. They pay for the lenses, which is great. Now the hearing aids, they bought a hearing aid company. So your hearing aids are $325 to $1,425 per ear. And that rate has been reduced by I think considerably from last year. The $45 a month one, the changes are $250 for the deductible, a tier 1 full gap coverage, and they do offer a $200 per year standard for no charge for the lens, and $200 for the frames, and of course they have the hearing aid. The other one is $84 a month, and actually the tier 1 is 0. The $150 deductible is on 3.3 to 5, and they give you $300 per year, and the hearing aids stay the same. And their star ratings are 4.5 for the PPOs, which is increased from last year. I think last year was 4.0. And as far as the duals, the different duals, common, I really don't, the difference between the two different duals, they have 2 different duals this year. There's one
Yes.
where they're covered completely with Medicare and Medicaid, and there's another one with Medicare and partial Medicaid. Am I correct?
Yes, one is full Medicare and one is Medicare if you have LIS. And I apologize, I just advanced the screen and I can't figure out how to advance to go back. There you go.
And as far as a star rating on there, do they get a star rating, Carmen?
Yes, they have a star rating, but I'm not sure. So the star
I'm not
ratings
sure
don't come
what
out
it is.
until
There it is.
October.
There are all the PPOs and the HMOs. So you can take a look at that. As
Yeah,
far as the enhancements this year with the duals, they're giving you a $200 allowance each year for the hearing aids. And of course, you've got the transportation, 48 one-way trips to and from covered locations, including medically related appointments and supplementary benefits. And I think there's $150 over the counter, which you can use for food and for over the counter drugs, right?
Mm-hmm.
Mm-hmm. And the other one, which is the QMB, the enhancement is the $200, $2,000 every year for the hearing aid, and $50 for the over the counter and food. And then you also have the 48 one-way trips. And that's about the enhancements for dual. And there's zero copay, zero payment for that. And once you qualify, that's excellent. You get a lot more benefits as far as you get $1,000 for dental. You get $200 per year for eyewear. You get the Renew Active Fitness Program. They own their own fitness company. And 42 meals over 14 days when you get out of the hospital. And the virtual and medical mental health visits are zero copay. And you also have the nurse line, which is excellent. That's being used a lot this year because of COVID. And I think that's about it for United Healthcare.
Perfect, thank you. So just so you know that the dual program is a program that's for people who have both Medicare and Medicaid.
Mm-hmm. And also, Aetna has a dual program too.
Okay, we have a question from Bob. Let's see. I'm going to let Bob answer his question live since I figured this one out. So, so Bob, how you doing? You're unmuted. I think. Hold on.
You can speak.
Okay, Bob.
Hello.
Can you unmute, Bob? So Bob said that he's been in many webinars and you can see people across the screen. When you're in a meeting, you can see everyone. When you are in a webinar, you can only see the presenters, and then everyone else is on the call, on the webinar, but you can't see them. That's the difference between the webinar and a meeting. Meetings can have hundreds of people in the meetings, and then you can see everyone. And in webinars, the only people that are seen are the presenters. And so I have Bob actually is here. And I'm trying to unmute you, Bob, but I hope I answered your question. This is my first time doing a webinar, actually. So I'm learning as I go, like all the buttons and stuff. And I did practice. Marilyn and I practiced yesterday, and we tried to get used to this, but hopefully we'll get better at it.
Oh, yeah.
Okay.
Practice makes perfect.
Yes. So let's talk about MVP. MVP has a great program this year. If you noticed last year, their cheapest program was $25, and now they've reduced it to $15. So the premium has gone down. They have new eye exams, routine eye exams for zero copay, as well as hearing exams at zero copay. They have a reduced outpatient surgery copay. That seems like a theme for all the plans. They're reducing the outpatient copay. They're reducing the outpatient x-ray rates, and there's a new eyewear allowance that they have in all of their plans. The diabetic supplies in 2021 were $5, and next year there'll be zero copay. And there's also reduced outpatient x-ray, which I think I covered already, copay for next year. MVP will continue the mom's meals after inpatient stay, which is pretty standard in the industry now. They'll continue a fitness benefit, which is also standard. They offer silver sneakers. They will continue the zero copay for the preventative dental. And so all the plans will have preventative at zero, which is your cleanings, your x-ray, and your exams 2 times a year. They will contain, at MVP will have zero virtual visit copays, even for mental health. You can have your virtual visits on your computer or your smartphone at zero. MVP has continued out of network coverage. And so if you leave the service area or you leave the state, and you can look up doctors for MVP and receive services. And of course, anywhere in the world with Medicare, you could have service in case of an emergency. And so if you're anywhere in the world and you have an emergency, go straight to the emergency room for urgent care, you will be covered. MVP started a Patriot program last year, and they're the only program that has offered in their Patriot program prescription drugs. Each carrier offers something for veterans, and MVP has an enhanced offering, which is very attractive. And so there are great new changes for MVP this year. There are more benefits than last year, and it's a great local plan. And I'm not sure of their new star ratings, but I believe they were 4.5 last year. And I haven't heard about the star ratings this year, but they're a great quality plan. And so let's talk about WellCare. And so WellCare this year expanded. If you will recall, last year, they were the first year, they were bought out by a company called Centene, who also bought Fidelis, and they bought Today's Options. So, and in buying that, they also bought Aetna's prescription drug program. WellCare is offering great benefits, great different offerings in many plans. They have the most plans of any carrier. This year, they may have 15 or more plans in Monroe County, or in upstate New York, I should say, alone. And so they have 3 Medicare and Medicaid plans, which is a dual special needs program plans. And those are for people who have Medicare and Medicaid. They have 3 of them with zero cost share, 3 different ones. Some are PPOs, some are HMOs. They have slightly different offerings, but they're pretty much for people with special needs. They have 2 Medicare give back plans. Those are the plans that pay you money towards your Medicare Part B premium. And WellCare has offered this 2022, 2 of them. There's a new PPO dual special needs plan for people who aren't Medicaid, but they have the low income subsidy. They may have extra help through Medicare. They may be getting their premiums paid for by the state, and their income is either is $1,458 per month or less for an individual. WellCare offers PPO plans like many of the national carriers. They have zero premium plans. And this year, all of their plans offer some over-the-counter benefits. Seniors like extra money, and they've answered the call, and they have put into their plans over-the-counter benefits so that you can go to the store and buy over-the-counter prescription drugs. WellCare will continue their dental, vision, and hearing aids programs of last year. Some plans will offer comprehensive plus denture coverages. WellCare also has a Patriot zero premium plan. Grocery delivery is part of their plan, and there's something new this year. It's called a robotic companion pet for seniors who are who are shut in. They will send you a robotic dog. One you don't have to feed. Maybe you need batteries. I don't know how it works. I haven't seen it yet, but they will offer this in many markets, including the upstate market, and the utilities flex card, which is totally something new. WellCare has 3 prescription drug programs, one targeted for people who are Medicare and Medicaid. There's one low premium plan, and there's one with a higher premium. And so there's lots of choices in WellCare this year, and lots of great benefits that they have to offer. let's talk about the Patriot plans. That's a lot of discussion about veterans and actually honoring their service. So just so you know, there are 4.3 million veterans over the age of 65, over 740 counties in the United States. And so that's why this is such a huge constituency group, because there are many veterans with needs, and the VA doesn't meet all the needs. So these plans are designed for veterans to sort of like provide supplemental coverages like transportation to and from the VA facilities, and some of them are far apart. Here, the VA hospital is in Buffalo, and they have something in Canandaigua. And if you live in Rochester in the middle of the winter, it's difficult to get back and forth. So many of these plans will offer transportation to and from. They'll offer dental, vision, and hearing aids. So if you don't have 100% disability in the VA, you may not get these coverages, even though you have a medical coverage. And so these plans supplement what they're receiving in the VA medical plans. Some plans offer prescription drugs, like the Medicare Advantage plans. We mentioned that MVP is one of those plans. And so just so you know, you're not allowed to have two Part D programs, but if you have drugs through the VA, it's not considered Part D. It's another entitlement through the VA, but it's not a Part D, so it's not a conflict. So you could have drugs that you can get from Wegmans and drugs that you can get through mail order. Some veterans prefer the mail order because they have a wider variety of drugs you can get, particularly for men. You know, before Medicare started off Viagra, the VA always offered it with no restrictions. And then there's other drugs in the same type of category. There's a meal program available for veterans who are ill. And then all the MA plans, just so you know, in Monroe County, Aetna, MVP, Excellus, WellCare, and United offer the Patriot program designed to supplement veterans in their medical plans. And MVP is the only one that offers the drugs with their Patriot program. And some of them are zero premium. A few have small premiums, but the plans are great plans. If you have Medicare and you're a veteran, it's something that you can have. Absolutely. And so the next thing we're going to talk about is prescription drug plans. So the prescription drug Part D sponsors, in January the 1st of this year, there was a new insulin model that was introduced, and it was strictly voluntary. So you found that in 2021, many of the Medicare Advantage private insurance companies only gave this benefit for people who paid a premium. And so if you had a zero premium plan, you didn't get it. So basically, if you have diabetes and you need insulin from January the 1st, you're hit with a bill of like $500 because you have to pay the copay, the deductible, and any other co-insurance. And that was cost prohibitive for many seniors, especially those with fixed incomes. So the government came up with this copay of $35 a month, period, is the maximum you can pay in a deductible phase, in the initial coverage phase, and the coverage gap in a donut hole. Your insulin would be $35 a month. New also this year is Walmart has an insulin program, and in their program, you don't need a prescription. Their program for insulin is $25 a vial. So if you know anyone who can't afford their insulin, or they're in the program that doesn't cover this new insulin model, and they have huge deductibles, let them know that they can go to Walmart and you never need a prescription to purchase their insulin. You go straight to the pharmacy counter, you ask for the insulin, and they will have it available for $25. And so that's big for people with diabetes. And new. Okay, if you have a prescription drug plan right now and you want to look around for other options, please contact the office and give us a listing of your current drugs, and we'll do some research. There's about 30 plan options available in Monroe County, and we can look and see what are the changes. Every year, the drug prices change. Sometimes the pharmacy benefit managers change. We said there are 6 top ones in the country. The main top 2 are CVS and Express Scripts. So sometimes carriers switch from one or the other and they get a better deal on drugs. So we like to do the research for you and take a look at that and give you an idea of where you can get your drugs from in 2022, more cost effective, or at least what you're paying now. Okay, so hold on, I have a question here. Okay, we still have that. The viewing. Okay, so let's go to the next slide. This slide is about programs that help you save money on your copays for medical and drugs. There are many, many programs, so don't ever go without having your drugs or your medical. Always call the office. We can help you find a program. One such program is one you hear on TV. We can help you save $148 a month. It's called the Medicare Savings Program. These applications are processed in our local Department of Social Services. When you go on the television, these people are often from other states, and they're not going to go to the Monroe County Social Services to get your Medicare savings program. You can be assured if you come into the office, we have applications here at the bottom of the screen here. And we can also put it in the chat. There is the email address to find the form, the Medicare Savings Program form. And if you drop it off at DSS, you can get your $148 refunded if your income is less than $1,469 a month for a single person, or $1,980 a month for a couple. You can qualify for up to one of 4 programs: the Qualified Medicare Beneficiary, the QMB Plus, the SMIMB, and the Qualified Individual. And I don't remember what the S, I know it's Medicare Individual, Medicare Single, Limited Income, Medicare Beneficiary. So that all of these programs will automatically get you something called Extra Help. Extra Help will discount your drugs 90%. And so your drug costs will be between $0 and this year $9.60. That's the most you'll pay, regardless of the cost of drugs. And then your Part D deductibles will be paid for by the government. Okay. Another thing you can do is you can apply for patient assistance programs through the area hospital. Both hospitals have it. The Unity Network has it, which includes Rochester Regional, Park Ridge, and St. Mary's. You can receive your co-pays covered, 100%, 80%, 60, 40, or 20. You can qualify for a 40% discount at Unity Dental. It works with all insurances except for Medicaid. Regardless of the insurance you have, if you have a copay, this plan can kick in and pay that copay for you. It's usually credited at 150% of poverty or less. You can get 100% of your copays paid. But if your income is a little higher, you can get maybe 80 or 60, 40 or 20. You can get something. This year, the form is downloadable and you can fill it out online, which is unique. You can fill it out online and email it over. It'll be processed within a few days, and then you'll get a letter telling you what percentage discount you'll receive through the hospital network, which is really cool. And so if you Google Rochester Regional and go to financial assistance, this is a long link, and I apologize, I couldn't find a smaller one. You go to rochesterregional.org and put in their patient assistance program. This form will come up, and you have an option of printing the form out or filling it out online. So you can fill it out, take care of it in a few minutes, and it can save you thousands of dollars depending on your surgery. And here's another thing. You don't have to be on Medicare to use it. You can be at any age to have this form. So you can supplement this with your current insurance. especially those with high deductible plans can use this, and it'll pay your copays for you. Same program exists at U of R. And U of R is Highland Hospital and the University of Rochester Medical Center. It covers your copays if you're income qualified. Unity Dental, this is an accident here. You don't get the Unity Dental, but hold on. Scratch that out, the Unity Dental. It works with all the insurance except for Medicaid, and it actually looks at 200% of poverty. So for a single person, you can make up to $25,000 and get 100% of your copays paid. For 2 people, there's another rate, 3 people, another rate, but you should look into it because it's worth it. Any MRIs, copays, or outpatient surgery, inpatient surgery, or any deductibles you may have, once the insurance pays, whatever's left over, this program automatically will kick in. You can Google U of R Charity Care application and it will come up. It looks like this, and you can print it out and send it to the hospital. Both hospital programs will require proof of income. So that means you can attach your award letter to it, or you can attach your pension letter or whatever you have as proof of income, and they will process it and send you a letter back. Okay, let's talk about Epic. There's actually 2 Epics. I want to just distinguish that. One Epic is the one we're going to discuss today. It's the Elderly Pharmaceutical Insurance Coverage Program. And it's a New York State Pharmaceutical Assistance Program. In fact, all states have similar programs. They all have different names. Our state, it's called Epic. The other Epic is the computer program that powers all of your medical records. So if you have the app for the U of R or the app for Rochester Regional, and it has all your blood work in it, your exams and your appointments, and it has your medical diagnosis and analysis, that program is called Epic. And it's statewide. So if you go to a hospital anywhere in New York State, your doctor can go to a computer, pull up your Epic report, and see your medical records. Even if you don't use the other hospital, but if you ever use it, there's about 10 years worth of your files included, and you can combine them together in Epic. So you can see your U of R records and your Rochester Regional records, especially for blood work. You know, the thing I like about it is when I get blood work, I get the results the same time the doctor receives them. And it's right on the Epic app. So that's a great program. If you don't have the app, you should download it for your phone. I recommend it because it's helpful instead of waiting. Okay, and then we'll talk about, we have a raised hand. So let's see. Okay, Robert, could you unmute? Robert, can you unmute so we can hear you? I'm trying to unmute you. Robert?
Yes, maybe I'm unmuted now. Is that true?
Yes, you are. Yay.
Good.
You did something, Carmen, and that
I don't
because I
know.
finally I got a message saying the host would like you to unmute. So I pressed the button to unmute. But prior to that, I was quite a bit confused because, excuse me, this screen is totally different than what I'm used to with the normal Zoom, the Zoom meetings that I've participated in. And I don't know why they distinguish between webinar and Zoom, but that's another topic. Anyway, and now I have a microphone that I can mute and unmute, which Diane has on her machine on the other side of the house, and I couldn't figure out how to get it for me. But anyway, I guess
I'm glad you got it.
I guess we're there.
Hi, Diane. Well, I'm glad you have it. I just wanted to make sure I can, and this is my first time using this, and I tried to unmute you before, but I didn't know what I was
Diane.
doing.
Well, and these computer systems, they don't give you any directions on how to do anything. It's, you know, it's, you know, you got to guess all over the place as to what to do, it seems, but
Yes, yes,
that's the way it
that
goes.
is correct. But I'm glad we got you unmuted. So I want to talk about Epic. I know this is something that you're interested in as well. Epic does a couple things. It provides a special enrollment period once a year. Any time of the year, once a year, you can change your plan. If you're Epic eligible, to qualify, you have to be 65 years or older and be a resident of New York State, and your income as a single person has to be $75,000 or less, or a couple, 100,000 or less. If you meet that criteria, you have one SEP a year. Epic will provide at no cost to you antibiotic drugs through your pharmacy, and it will pay up to $36.40 a month if your income is less than 23,000 as a single person, which is right here, or 29,000 as a married couple. They will pay your Part D as in dog premium. And then your drug costs will be between $3 and $20. But Epic has a deductible. The deductible is based on your income. And so when you can Google the form online and it'll show you all the income criteria for single people and couples, and you'll have an idea of what the deductible is. It's always good to do the math, see if it's worth it to pay the deductible, because the drug cost will be $20, but if you pay the full cost and it's less than deductible, then it may not be worth it. Because a lot of the drugs we're taking today are either tier 1 or tier 2, and most plans will offer those drugs at zero copay. And so it's always, always alarm you to do the math, and we'll help you do the math. If you have any questions, call Lifetime Financial Group, or call our office, and we'll do the math for you and see if we can help you get this all figured out. If you want to download an application, at the bottom of the screen, here is a download button, so you can download it to join the Epic program. Okay. The next thing I want to talk about, go ahead.
We already belong to Epic. We have for a couple of 3 years, whatever it is. But the reason why I was recently asking you questions, I am trying to convince some of my colleagues to join Epic as well, because it doesn't cost anything. And I have noticed some very small benefits, particularly with the antibiotics. And and I am particularly intrigued by the fact that if you have the choice now of, say, plan ABC, and in February you decide you don't like that, and as long as you're under the deadline of sometime in March, I believe, to make a change to XYZ, the thing I like about it is if something bad happens to you further into the year, say June or July, I believe you can make a change again.
Yes.
Because you're on Epic. And as an older person with some of the problems I've had over the last couple of years, that's a very, very important point. And I have, well, just yesterday I was with at breakfast with some friends of mine, and they said, well, it's income based. And I says, yeah, it is, but it's worth it because it doesn't cost you a dime. And
no, and you don't have to pay the premium if you don't use it.
Say, excuse me?
Right, Bob? If you don't use it, you don't have to pay the premium, the deductible.
There are no premiums. There are no premiums whatsoever. None, zero.
Yeah. Yeah. It's a good benefit. And it's like you said, it's free of charge that anybody can join, and it only takes 5 minutes to complete the application.
That's right.
And that's it.
Yep.
Yes, and there are also other programs. Each pharmaceutical manufacturer has their own drug program for name brand drugs. So if your drugs are expensive, go to their website and take a look and see what programs they have available for your drugs. They have discount cards, they have freebies, they have a program where they'll deliver the drug to you every 30 days, either you directly or your doctor's office at zero copay if you meet their criteria. There are many internet foundations. There is the TAF, what is it called? The Assistance Foundation.org. The U of R uses this foundation a lot for patients. These are individual private people who have foundations. They donate money into this foundation for causes, maybe cancer, for diabetes. It may be a bequest that they put in there, and every day the amount changes because hospitals search this thing every single day looking for patients to help them. And so the Assistance Foundation, a couple of my clients use it because they have very expensive drugs that would be cost prohibitive. And U of R, especially pharmacy, will actually do the research for you. They have someone that they pay to go in here every day and look for money for people. And so keep that in mind. There are others as well. You can qualify for Medicaid. That's one. And one way to qualify for Medicaid is through the spousal refusal, which means that sometimes couples are penalized because of their income. So the spousal refusal allows one spouse to refuse to use their resources towards the other spouse. And if your spouse has a lower income than you, they can qualify for Medicaid even though you don't, and then still get benefits if they need them for long-term care. And one other way is to use a pool trust. At any income, you can go into a pool trust, which is a very complicated process, but basically you keep a certain amount of your money in your account and the rest of your excess income goes into the trust, and then you'll use that money to pay bills out of, and in exchange for allowing the trust to pay your bills with your excess income, you get Medicaid. Some people it's very helpful for at different stages of life when they need more care, as Medicare does not cover long-term care. It only covers care throughout the year, but if you need anything more than that for long-term, you have to have a long-term care policy, and many seniors don't have that, or you have to have income that qualifies you for Medicaid. And these two programs, the pool trust and the spousal refusal, helps you qualify for Medicaid, which is pretty neat. All right, here's our last subject. You want to break for a raffle? We got a couple things to raffle off. We have a cart that Tawana can show you. She's like the Vanna White of today. we have, they're in the conference room. We have one of those carts that you can take to the grocery store and put stuff in. We have a professional iron to raffle off. We have these real neat stress-free candles that we like to raffle to give to someone on the call. So the only problem is that either you pick it up from the office, or we'll have to figure out how to get it to you if you're not able to pick it up. And if I'm in your area, I'll drop it off. But we have these really neat things that we want to make sure that you have today. And the first thing is the iron. Look at that. It's a Sunbeam iron. It's a classic model. It has steam and everything that an iron has. And we like to give it to the first person that can put it in the chat. What does Medicare Part A cover? And then the second thing we have is this beautiful Tuscany candle. It's Vineyard Retreat. It's a great smell. It'll make your house smell wonderful. And we have that available to the next person. So let's see who can define Medicare Part A. The first person that defines it in the Q&A box wins. And then the second question is, can you define what a Medicare Part C is, or let me just rephrase that. If you can tell us the difference between a Medicare Advantage program, so skip the Medicare Part C because that's Medicare Advantage, and the Medicare Supplement program is, you win. There are two different programs, Medicare Supplement and Medicare Advantage. If you can tell us the difference, you win. And put your answer in the Q&A. Anybody wants to win? Okay. So the next prize we have is this beautiful card. It's a shopping card that you use put your groceries in if you're tired of carrying things around. It's pretty sturdy. It has different levels in it for fruit. You can take it to the farmer's market and put your stuff in there. And the question that we have for that is a hard one, so I'm not going to answer that one. Okay, but let's see. We need another question. Define the Medicare Savings Program. What does that do? Put it in the, hit the Q&A button and write your answer in, and you can win. And so in the meantime, we'll go on to, and we have other things to wrap up, we'll go on to talk about Medicare fraud. And so we've all seen television and we've gotten many calls, I get them too, people who want you to believe you won the lottery. You know, you can get this free, that free, that free. All thing you have to do is call us and do it right now. And it's repeated, do it now. If you look at the small print, they're not insurance agents, they're marketing companies collecting information, and they're storing it in their computers. Because last year, the last year of the administration of Donald Trump, he changed the Medicare law. It used to be that once you have permission to contact, that's the only way anyone can contact you regarding Medicare, it expired in 12 months. And so Donald Trump changed it so it never expires. So when you call that number, your name, your information goes into their database and it's sold to agents like me. And so you're getting calls all the time. You know, they'll sell to one agent and he paid for it, so he wants to get his money worth, so he's going to call and call and call. Then they'll sell to another agent after that, and then another agent. So your phone will ring off the hook for months. Okay? And sometimes when you've forgotten about it, let me tell you about a fraud. One of our clients came in and said someone called him and asked him about some stuff, and he said he wasn't interested. And they said, well, just give me your birthday. And he gave it to him. And they switched him to a different plan. So he comes around in here trying to figure out, how did they do that with only my birthday? I gave it to him because I didn't think they knew. And so the first thing I asked him is, did you ever call one of those numbers on television? And he said, yeah, but it wasn't them. I said, well, that's how they did it. Your information is stored in some computer, and the only thing they didn't have is your birthday. And so when you give out your information, after the government has secured your Medicare card by taking your Social Security number off, many seniors fall for the trap and give out their information and to a stranger that they can't certify. They don't know who they really are, and they can't identify them. And I'm not saying that everybody's a fraud, but you have to be really careful because there's about $40 billion in Medicare fraud every year. And so seniors are targeted at a higher rate more and more. So you should really watch out for them. So here are some do's. Do treat your Medicare card and number like your credit cards. Don't give it out. Do watch out for identity theft. Do be aware that Medicare doesn't call or visit to sell you anything. In fact, it's illegal for anyone to knock on your door unsolicited. Okay? Illegal. It's illegal for them to call you unsolicited. But if you call a number and put your name on the list, then they're going to say that was your permission for them to call. Okay? So be very careful to safeguard your information. Don't give out your Medicare number except to your doctor or other Medicare provider. And don't carry your Medicare card unless you will need it. Okay? I get these calls just like you. And I am an insurance agency. I get calls telling me that somebody's used my social security number. If I don't hit this button right now, then I'm going to be sued by the IRS and all kinds of ridiculous stuff. And so you have to be on guard. And sometimes I get caught up in stuff too. Sometimes I get a fake email and it's telling me that somebody has charged my Amazon account, and they'll say there's a delivery coming to your house and we want to reschedule, hit this button, and I hit it and then they break into my computer. And so I have to, discipline myself, never hit a link, because you hit a link, they're in your stuff. And they can break in your stuff anytime. They've done it to banks, to government, and everybody else. So don't be careful. Be very careful. Okay? And so that's what I want to say about Medicare fraud. Do we have any takers? No one's going to do the poll. Come on. And so I want to let you guys know that we were selected as one of the best health insurance agencies in Rochester, one of the top 10 for 2021. So we're really proud of that honor. And it's all because of you and your support of us. And we thank you for that. We're continuing to support our agency. If you want to schedule an appointment today or any day, the annual enrollment period starts tomorrow. That's when you can switch your plan. But if you want to keep your plan, you don't have to. There's no obligation to switch. If it works for you and you like the plan, you can keep the plan without doing anything. It will automatically roll over. But if you have any questions and you want to look at some information, you want help filling out one of the assistance forms for the hospital or the Medicare Savings Program, you can email us. You could go to our website at lifetimefinancialgrp.com. You could go to enroll online at medicareful.com/lifetimefinancialgroup. There's all kinds of ways you can enroll that's safe. You want to make sure you're safe from COVID. That's a problem for the whole entire planet, and it's a serious problem. So we're all trying to be safe and healthy and make it to the next year, and hopefully make it to the point where they figure out how to get rid of it, how to eradicate it for real. I've gotten 2 shots, but you can't be too careful. I had a COVID scare just last week. I had a COVID test this week. I was in a meeting on Friday. This is how things can happen with an individual who had a meeting a few days before he met with me, and the person he met with that he was in the car with was tested positive for COVID. So I had to go and get a COVID test because I was exposed to this gentleman in the meeting, and I didn't know if I had it. It turns out that he didn't have it, I didn't have it, and nobody else in the meeting had it. But you can't be too careful, because you don't know if someone's a carrier and they have no symptoms, and you don't want to give it to anybody else. Because COVID doesn't have a look. You don't know who gave it to you. You can't identify where it came from, and no one looks like they may have COVID. So to be safe, I went and got tested, and I tested negative. So I'm going to continue to wear my mask throughout the season, even though it's uncomfortable and I hate it. I'm wearing it anyway because it's going to keep me safe and hopefully keep me alive. I had a client who died last week too. He didn't have the COVID shot. He didn't want to take it. He just turned 65 in the summertime. I just signed him up for insurance, and now he's gone. Both he and his wife contracted COVID, and he passed away. So I'm not saying that I'm trying to push you to get the vaccine. That's an individual decision, but you have to be careful of the virus. It can kill you. Okay, so we have these things to give away, and no one. Is there, okay, was the questions too hard? Questions too hard? What happened? I'm trying to give this stuff away, and I'm looking for a question. So the one question was, do you know the difference between the Medicare Advantage program and the Medicare Supplement program? The other question is, what does Medicare Part A cover? We didn't do a Medicare 101, but we usually do. We're going to do more webinars as we get used to this on Patriot plans, Medicare Part A, Medicare 101, different carriers, to, drill down to all the benefits of the carriers in a webinar. We can't do it here because this is too much. We're supposed to be here just for a few minutes to go through stuff, but we went through every single plan detail. It would take hours. You would be sleeping on the other side and bored to death. So we like to do just one at a time. We're going to do one on special programs, and then we'll drill down the applications to show you how to do those. And of course, if we do an application for you, we do those for everybody. You come into the office and you qualify for one of the programs, you get enrolled, and we fax it over that day to make sure that it's taken care of. We will do other webinars on fraud. We'll bring someone from Epic in to go through the Epic program in details of all the things that you could be exposed to or benefit from the Epic program, the Epic pharmaceutical program, not the Epic hospital program. So there's all kinds of things we can do, especially during the shutdown. Fortunately, we had a shutdown, so now we're all online, so we're safer than we were before. And we're learning how to communicate like the Jetsons, on teleconference. Okay, so I guess none of my prizes were anything anybody wanted because no one tried to get them. Is that right? They're great, practical things, that people could use.
Yeah.
So okay, so let me see how many people we have on here.
10.
So we have a candle for the first 5. Let's see. We have a candle for Robert Gorsica, Diane, Carol Platt, Douglas, and Linda Nolan. So we have 2 couples. So let's see. We have 5. Josephine Blue Grant, and let's see. I can't see the other person down here. Josephine. Okay, so if you're on this call, we got a candle for you. How about that? Automatic. These are nice candles. They came from Wegmans. I think you might like them. We have a candle for you. I can't see the other name here, but we'll have a candle for you. Oh, Miss Campbell, we have a candle for you. So we got candles for you. Could you write their names down, Tawana, to make sure we get them the candles? So we have the Gorsicas, the Nolans, Carol Platt. We have Josephine Blue Grant and Sherelle Campbell. Congratulations, you're candle winners. Thank you so much for tuning in. Can I answer any questions you may have? And if you don't have any tonight, we can meet via Zoom, in person, via an app. Okay. You're welcome, Douglas Nolan. He said, thanks for the candle. I was over at Baden Street. You weren't there, so I don't know how to contact you. I might have to bring it to your house. Let me know. Unless you guys want to come in for a meeting, let me know. If you want a candle, let me know how to best get it to you, and I'll make sure you get it. Your name will be on it, and it's yours. They're nice candles. I think you may like them. So thanks for joining us.
Thank you for this wonderful webinar. It was great.
Thank you, Marilyn, for participating.
Yeah.
And thank you for telling us all about United Healthcare Plans. This is still a new medium. I sent this out to 1,300 people, the letters, and we have 10 people who joined us. So a lot of people aren't technically savvy, and it's something that we're all learning to do. I'm learning at the level I'm at, learning how to do different types of things, but some people are just learning how to get on the internet. And so we respect that, and we'll continue to reach out to try to do more of these throughout the year.
I love them. It's a work in process.
It's a work in process for all of us. We have a new internet website. That's a work in process too. And that's something that I'm learning how to do. But I'll see you guys throughout the AEP. Please call us with questions. That's why we're here. We can help you answer any questions you may have. We can look at situations. If you have any difficulties with your drugs or your health care, call us immediately because we want you to get your health care on and your drugs on and make sure you stay alive. Okay? Don't skip your drugs because you're afraid of the cost. If you're a diabetic on insulin, check Walmart. They have an insulin program without even a prescription to make sure you get your insulin. Okay? Thanks again. And if there's no questions, oh, wait, I got 4. Hold on.
Oh, 4.
Okay, you can leave it at Baden Street, Douglas. Thank you, Bob, for coming and joining us. I appreciate it. And
Thank
I will
you.
leave your candle at Baden Street. You're welcome. Thank you. And I really appreciate it and hope to talk soon. By the way, Bob, I hate to mess your name up. What's your, I call you Gorsica, but I know I'm always wrong.
Gashora.
Gashora, yes. Bob
Yes,
Gashora is the best bread maker in the world. He has like 10 different varieties of bread. He has a 30-day bread. He has dough that's probably ancient. How old is that stuff that you make? You know, that stuff that you use for bread?
Well,
Add to?
the sourdough.
Yes, the sourdough stuff.
Well, I do a trick. I don't do what the normal people do because I'm not normal. What I do is after I made enough sourdough to prepare the bread that I'm making today, the leftover stuff I freeze. I refuse to do what a lot of people do, and that is they feed it every couple of days. It's always in the refrigerator. They feed it. I've got sourdough that has been in the freezer for 2 or 3 years sometime. And I bring it out and I wait a couple of days to let it thaw out, and I go reuse it, remix it, and yeah, I'm good to go. So, and that's totally maverick the way most people do it, but it works for me, so that's what I do, and it saves me a lot of time and agony.
Well, thank you. One thing that I look forward to when I visit Bob is he has all different varieties of homemade bread.
Not at the same
Sounds
time,
good.
but I can do it. In fact, Carmen, it's too bad you didn't visit today because I just made 2 loaves today, but
Oh.
Oh, Carmen, you missed out.
I miss it. Well, I'll catch up. He makes those every day. I'll catch up one day when you have some.
all
But
right.
thanks everyone for joining us.
And thank you so much, Carmen. Thank you
You're
very much.
welcome. I hope you learned something. I kind of like
did.
went through it quickly. But if you have any more questions, please call us.
Thanks again.
You're welcome.
Thank you.
You're welcome.
Bye-bye.
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 Thanks, Diane.
Bye, Carmen.
Bye-bye. Thank you guys for joining with us. We have to do it again sometimes. Oh,
Yeah.
Cal Pratt has your hand up. Hold on.
I like it.
Carol? I'm trying to find your hand. I know it's up. Let me see if I can unmute you, Carol. Carol? I'm sorry, I'm not sure what I'm doing wrong here. I'm trying to unmute you.
Now you can talk. Now you
Carol?
can talk. It's Diane.
Hi, Diane.
Hi.
How
There,
are
she's
you?
there.
Oh, you can't see me. Hi, I'm waving too.
Okay. Well, it's so nice to hear from you, Diane.
Well, it's nice to hear from
Thanks
you
for
too.
joining us. Thank you. Thank
It
you.
was certainly different. And it's not my mode. I prefer a phone. Hello. One ringy
Yeah.
ding, yeah.
Me too. Me too. We're all learning together and surviving together.
Somehow.
So, yeah, we'll do it. Next year, we'll all be together and we'll be outside and we'll have an event inside. I'd like to do the in-person events because you can see people and get caught up really quickly.
Yeah.
Yeah,
This staying apart is really getting boring, isn't it?
yeah, it's been boring. It's real boring. So we'd like to get together soon, safely, and hopefully we will make it to the other side.
Yeah.
That's about all we can. Well, I don't know. There's 2 meetings on that, so I'd rather it be on this side of the grass if you don't mind.
Yeah, I mean, not the other side of the universe, but the other side of COVID.
Oh, yes.
Yeah, I know. Someone posted on Facebook, I just got my wings. I thought, what are you, dead? And I think they're going to be a stewardess or a pilot or something, but I was like, what? We overuse some terms so much that we just lose the meaning and definition.
Yep. That's the truth.
Yep. Yeah, so I'm signing out for now, but not forever. So reach out, email, text, telephone, computer, or we can do a Zoom call anytime. Thank you, Marilyn. You were wonderful. Thank you, Tawana. You were wonderful.
Thanks for inviting
And
me.
of course. And
Have a
we
good
should do
evening,
this again.
everybody.
Good
Have a good
evening.
evening.
Bye-bye.
Bye.
Bye-bye.